Treatment of Certain Heart Conditions by Homeopathy by Douglas Morris Borland. Section Angina and Pseudoangina. Aconite. If one thinks for a moment of any cases of the kind one has seen, one finds, I think that the outstanding characteristic of the majority of these cases in their first attack is an absolutely overwhelming fear. The patient is certain he is going to die, and that he is going to die very speedily, and he is terrified. He is quite unable to keep still, and yet any movement seems to aggravate his distress. In case of that sort, a dose of aconite high will give relief almost instantaneously. I have seen such a case and put a dose of aconite on the patient's tongue, and before the medicine could be swallowed, the patient was feeling better. It is almost instantaneous. I usually carry 10 mg as highest potency in general practice, and I gave aconite 10 mg. That man had a similar attack at later date, and the anxiety, the distress, and the fear were nothing like so marked because he had come through one attack before. The aconite had no effect at all. That has been my experience. Where one is dealing with the first attack and the patient is quite certain he is going to die, aconite does relieve him right away, but it does not act in the second or later attack. So if one gets a man in his first attack, a dose of aconite will probably help, and no time he will be feeling more comfortable. If he has had a previous attack, however, aconite is unlikely to help him. Cactus. If you have a patient who is having a later attack, much the most likely drug to help is cactus. Cactus has a good deal of anxiety and fear, but it is quite different from that of aconite. It is not a fear that the immediate attack will kill him. It is more a conviction that he has an absolutely incurable condition which will eventually wipe him out. That is one point about the cactus indications. Another point is the type of the actual distress of which the patient complains. He feels as if he had a tight band around the chest, which was gradually becoming tighter and tighter, and that if this tightness does not let up soon, the heart will be unable to function. It is that feeling of increasing tension which gives the cactus indication. In addition to the constriction, there may be stabbing radiating pains from the precordium, but they are not so characteristic of cactus as the intense constricting feeling, which is, of course, just exactly how the majority of angina patients describe their feeling. In these acute conditions, I always give my drug high because it acts much more quickly and one must get relief as quickly as possible. Arsenic. Occasionally one comes across a patient having an anginous attack with very similar constricting feelings, not quite so intense as in cactus, where it seems to be dominate the whole picture, but still a definite feeling of constriction. The patient has been ailing for some time, is rather anxious and worried, very chilly, and accompanying the feeling of constriction, there is a pretty acute, distressing, burning sensation in the chest. These angina patients respond very well to a dose of arsenic. I have never seen arsenic do anything in angina's attack except in the rather broken down, ill-looking patients, who is a bit pale, rather withered looking, very definitely anxious, fearful, with the sense of constriction accompanied by the burning discomfort in the chest, and arsenic does relieve these quite quickly. Iodine. There is another type of case which is very similar to that, with very much the same sensation, but the feeling of constriction, the feeling of tension, is described as being actually in the heart itself rather than involving the whole of the side of the chest. The patients are just about as anxious as the arsenicum patients. In fact, All these anginous patients are anxious, but instead of the intense chilliness of arsenic, they are uncomfortable to heat and in a stuffy atmosphere. They are just about as restless, but instead of the pale, drawn appearance which you get in arsenic, they tend to be rather more flushed, and as a rule, they are dark-haired, dark-complexioned people. They are usually rather underweight, in spite of the fact that one gets a report that they have always been pretty good livers, and they very often have an appetite above the average. Although they have not been putting on weight, these cases respond exceedingly well to iodine. Spongia. There is another type of the case in which instead of the complaint being of constriction, it is of the sensation of progressive swelling in the heart region. It feels as if the heart gets bigger and bigger until it would finally burst, and this sensation of fullness spreads up into the neck. This sensation of fullness and swelling is very much aggravated by lying down, when the patient feels as if he would nearly choke, and it is accompanied by pretty acute pain. The patient themselves are chilly, and any drop of air increases their distress. In addition to their feeling of distension, they usually complain of more or less marked numbness, particularly of the left arm and hand, though very frequently there is numbness of the hand without any involvement of the arm, and not infrequently they complain of numbness of the lower extremities too. As a rule, the face and neck give you the impression of being somewhat congested. They do not have the pale, drawn, wrinkled arsenicum appearance. These cases respond well to spongia. Spigelia. There is another drug which is useful in the case which has not got the typical anginous constriction, but has much more the pseudoanginous stabbing, radiating pains, sharp stabbing pains starting in the precordium, spreading up into the neck, maybe across into the right side or maybe down the left arm. Following these shoots of pain, there may be more or less numbness involving the whole affected area, and as a rule the pain that they stress is a little eased by turning over on the right side. Accompanying the stabbing pains, there is always more or less marked hyperesthesia over the precordium. If you attempt to percuss out the area of cardiac dullness, the patient resents it extremely. Any movement aggravates the pain, so brings on violent attack. These cases respond very well indeed to doses of Spigelia. Lilium tig. There is a condition which is not an angina at all, but which one meets within hysterical women. One fails to find any cardiac lesion, but the patient will produce a symptom picture which one finds difficult to distinguish from a true anginous attack. That is to say, they have very marked stabbing, radiating pains, and they very often have an intense hyperesthesia of the chest wall. They are very depressed, they are very frightened, and they are intensely irritable. They are sensitive to heat, and their distress is aggravated by any movement. In addition to their stabbing pains, they have the anginous sense of constriction, tightness of the chest wall. These cases are usually associated with some kind of pelvic lesion or a history of having had some gynecological illness. I have seen quite a number of these cases now in which I have had an electrocardiogram done which showed no lesion at all, and all the symptoms have cleared up entirely on doses of Lilium tig. There are two other medicines which are of great value in treating heart conditions, namely Crataegus oxycantha and Lactodactylus mactans.